Hi, my name is Victor Baca. I'm a respiratory therapist at SCL Health Good Samaritan Medical Center. Here today to talk about a specialized bronchoscopy called Ebus bronchoscopy. An Ebus bronchoscopy is an endobronchial ultrasound bronchoscopy, Ebus for short. It's a special bronch performed by a pulmonologist or other trained medical professional to help diagnose certain kinds of, or evaluate certain kinds of lung disorders like lung inflammation, infection, or cancer, typically within the lymph node. The ebuscope has a specialized bronchoscope with an ultrasound probe attached to the end that creates an image of lung and nearby lymph nodes in order for the physician to accurately locate and evaluate areas seen on x-rays or PET scans or CT scans that need some sort of evaluation. An Ebus procedure can be done with general anesthesia or conscious sedation, depending on the provider and facility protocols. Commonly used medications during the procedure for conscious sedation are Versed and fentanyl. And if the patient requires general anesthesia, they can have a combination of Versed, fentanyl, diprovan, and anesthesia gases. Commonly used medications that are delivered via the bronchoscope are lidocaine, phenylephrine, epinephrine, and isosaline. Doses of lidocaine can be anywhere from 1 to 4%, phenylephrine 0.25%, and epinephrine 1 to 10,000 ratio. Lidocaine is used to help for the cough reflex. Phenylephrine is used for control bleeding, as is epinephrine, and isosaline is also used to help control any bleeding that may encounter during procedures. So there's two types of Ebus bronchs, linear and radial endobronchial ultrasound bronchoscopies. Here again, it just gives you a little background about the procedures. We'll go over the types of linear and radial a couple slides down the road here. Linear Ebus shows a high diagnostic yield of mediastinal lymph nodes. It's commonly used in evaluation of lung cancer, but also can be used in other type of diagnostic evaluations of mediastinal masses, for example, sarcoidosis or some type of reactionary process, infection, inflammation in other parts of the body that manifest in the mediastinal lymph nodes. So again, along with the PET scan and rapid on-site cytology ROSE, the Ebus procedure yield can be relatively high. Radial Ebus, which is used for diagnosis of more peripheral lung lesions, is also a technique that's available to the physician to evaluate lesions that are more peripheral from the carina. The diagnostic yield of a radial Ebus is of a lot of peripheral lung tissues is helping reduce the number of diagnostic thoracotomies. Sometimes a lesion that's more peripheral in the lung was not able to be reached via traditional bronch. Patient would have to undergo thoracotomy, which is, depending on the patient's situation, can be have other high risk outcomes, since the patient does have to go under more prolonged general anesthesia. It's a more invasive surgical procedure. So along with that, sometimes comes more complications for the patient. During the procedure, as the Ebus procedure, the ability to get a fine needle aspiration sample of the lymph node or lesion, and availability of pathologist at the bedside to prep the slides in the goal of giving a rapid at the bedside diagnosis of any process that's going on with the patient, for example, cancer, maybe sarcoidosis, some type of or other type of inflammatory process. So here's the two types of Ebus equipment. One is linear and one is radial. Linear Ebus is the left scope on the left is a conventional bronchoscope, and that currently it shows a radial probe. It's kind of hard to see, but the radial probe is on the right hand side there, which has two types of Ebuses, and you can see one is the far right is the sheath, and the two pictures of the sheath and the sheath with the radial probe at the end. And what the radial probe is doing is that little ultrasound device, it rotates and it gives you a 360-degree view of a peripheral lesion. The convex probe or linear probe is used more for mediastinal evaluation of lymph nodes. As you can see, the tip has there's a little ultrasound tip there, and the top of it shows with the balloon deflated, and the bottom shows with the balloon inflated, and the needle coming out of the scope that would go into the lymph node for fine needle aspiration. The balloon acts as a aid to help clarify vision of lymph nodes in the area that the physician is evaluating. So again, here's for start with is a linear Ebus. Lower left picture is a representation of how the Ebus scope is positioned. So the scope is advanced to the carina. You can see there's different stations of lymph nodes in the mediastinal area. So the physician would have, with the use of PET scans, CAT scans, or X-rays, would have an idea of what lymph node is they're targeting, what lymph node is enlarged in his evaluation. They advance the scope to that area. In the bottom right hand corner in slide B is a live view of the scope against the tracheal bronchial wall, with the needle exiting and into the lymph node. Still in slide B, on the right hand portion, you see the ultrasound image, and the top 12 o'clock position is that darker area, that's a lymph node, and at about the 1 o'clock area you see a gray straight line figure. That's the needle entering the lymph node, as the provider is attempting to get a fine needle aspiration of that lymph node. And lymph node A, again, is that shows the bronchoscope with the ultrasound tip, the needle coming out, and that's the part that will go and enter the lymph node. Again, the top picture shows the ultrasound probe with the balloon inflated that would help aid in visualization of the ultrasound area, the area you're ultrasounding. The radial Ebus is the Ebus scope that is used for more peripheral lesions. Far left slide shows the bronchoscope, and for the radial Ebus, the sheath and radial tip are used in combination. So the left hand part of the slide shows the radial probe in the sheath, which is advanced into the target area under fluoroscopy, which would be on the right hand side. The top right hand side is a fluoroscopy view, is the scope is advanced to the segment of lung that the physician is targeting. The sheath and the probe are advanced out into the lesion. The probe is then, the sheath is left in, the probe is taken out, and the center part, the slides, are a piece of equipment that are used. One is a brush for a brushing biopsy, and then a forceps, biopsy forceps. So the top left again, or top right slide. It shows the CAT scan slides of a targeted area with a lesion in the periphery. The middle slide shows what ultrasound view looks like as a radial probe is advanced to that area. It's at this point it's technique wise of what the area the provider is looking for into the lesion. Top right hand picture shows the bronchoscope, fluoroscopy view of the bronchoscope into the segment. As you can see, the sheath, a little lighter gray area coming out of the bronchoscope, so the sheath, which is into the target area lesion, and then the brush and the forceps will be advanced through the sheath to hopes of obtaining tissue. And the bottom part of the right hand slide shows lymph tissue with different type of cells that the pathologist will review. Again, the goal is to identify any abnormal processes and be able to at least say yes, we have diagnostic lymph tissue. Second is that we have, in hopes that you're able to maybe the pathologist is able to make a bedside diagnosis of maybe say some type of cancer or no cancer or sarcoidosis or other process of inflammation. So again, just to go review, an Ebus bronchoscopy is a special bronch used for diagnosis of lung disorders, inflammation, cancer, things of that order. The yield is the benefit of the Ebus bronchoscopy is the yield is relatively high, which means you're able to get lymph tissue or lesional tissue from a peripheral Ebus, able to in real time with the pathologist at the bedside evaluate the fine needle aspiration samples in the goal of identifying lesional tissue, maybe cancer, maybe inflammation like sarcoidosis, different processes like that, which the other option for obtaining those samples would be some type of very invasive surgical procedures, which sometimes, depending on the patient, can come with increased risks. Thanks for your time.